Alright team, here are the symptoms we have. Eosinophilic fasciitis, infections associated with diseases and pneumonitis. What are we dealing with here?
Could it be some sort of autoimmune disorder with these symptoms?
I'm thinking more along the lines of an underlying infection causing these issues.
Pneumonitis could indicate a lung infection or inflammation.
Maybe it's a combination of factors we're missing.
No. It's Ludenbacher's syndrome, a rare heart condition that's causing all these symptoms. We must act fast.
But a nephrectomy, that's a risky procedure, Hawks. Are you sure that's the right call?
I don't know about this, Hawks. It could do more harm than good.
I have my doubts too, but if you're confident, we'll proceed with the nephrectomy.
Damn it, I'm the head here, and I say we go ahead with the nephrectomy. We need to save this patient's life, no matter the risk. You called me in, Tracy. What's the problem?
Hawks, I heard you want to perform a nephrectomy on your patient with Ludenbacher's syndrome. Are you sure that's the right course of action?
Of course I'm sure. I've been in this field for years, Tracy. I know what I'm doing.
I understand your experience, but nephrectomy is a major surgery with risks involved. Have you explored other treatment options?
I don't need to explore anything else. This is the best course of action for my patient.
Hawks, I just want to make sure we're considering all possibilities before we proceed with such an invasive procedure.
I don't need you questioning my judgment, Tracy. I know what's best for my patients, and I won't have you doubting me.
Hawks, I have full confidence in your abilities. But as your boss, I have a responsibility to ensure we're making the right decisions for our patient.
Well, I'm the one treating the patients, Tracy. Let me do my job without interference.
I trust your expertise, Hawks, but I still think we should discuss this further before moving forward. Can we sit down and go over the case together?
Fine, but I still believe nephrectomy is the best option. Let's discuss it, Tracy.
Doctor, oh no, the patient is in critical condition. This wasn't supposed to happen. Doctor, I need to tell Hawks that the nephrectomy was not the correct treatment for Ludenbacher's syndrome. How did this happen? I must inform him immediately.
You stupid sons of bitches. You nearly killed our patient with your reckless choices in nephrectomy and diagnosis.
But, Dr. Hawks, we thought...
You thought wrong? What a disgrace.
I still believe it was.
You believe? What do you know? You're as clueless as the rest of them.
I agree with Kelly, I think.
Oh, of course you do. Always following blindly instead of using your brains.
But we were just trying to...
Save the patient? You call that saving? You call that a proper diagnosis? Pathetic.
We can still correct our mistake, Dr. Hawks.
Correct? I don't trust any of you to correct anything. I'll handle this myself. You all stay here and contemplate your failures.
Dr. Hawks, please give us a chance to prove ourselves.
Prove yourselves. The only thing you've proven today is your incompetence. I'm done with all of you. Shock storms out of the room, leaving Gary, Kelly, and Frank looking at each other in disappointment. I can't believe I still haven't figured out what's wrong with this patient.
Maybe you're just not as sharp as you used to be, Hawks. Have you considered a rare genetic disorder?
Ha, very funny. But no, I have ruled that out already.
What about a metabolic condition? Or maybe it's a side effect from the medication?
Wait a minute. I think I know what it is now.
Seriously? What is it?
I can't believe I missed it before. It's an autoimmune response triggered by the patient's allergy to a common ingredient in the medication.
Wow, impressive. You figured it out just like that. That's my cue to leave, I guess.
Yeah, see you later, Johnson. Thanks for the banter, it actually helped me think. I know you're all surprised to see me storm in here without the right gear, but trust me, I have a groundbreaking diagnosis for our patient.
This is unacceptable, Hawks. You can't just barge in here like this. You're compromising the patient's safety.
I can't believe this. How can you be so reckless? We need to follow protocol for a reason.
Hawks, you need to leave the operating room immediately. This is not how we conduct ourselves in this profession.
Listen, I understand your concerns, but I have reasons for my actions. Ludenbacher's syndrome was a misdiagnosis. After further evaluation, it's clear our patient has cherubism. Trust me on this one. Thanks, Tracy. It was a challenging case, but I'm glad we got it right in the end.
Yes, congratulations on finding the right diagnosis. But you have to admit it could have been avoided if you had listened to me initially.
Listen to you. You were so sure it was something else. I had to push for further tests to get to the bottom of it.
And that nearly cost the patient their life. You should have trusted my judgment from the start.
Trusted your judgment? You always jump to conclusions without considering all the possibilities.
I consider plenty. Maybe you're the one who needs to work on your listening skills, Hawks.
Oh, please. If you had just listened to me in the first place, we wouldn't be having this argument right now.